Pope Francis praises the work of a group operating more than a half a dozen health facilities in war-torn Syria. The Holy Father met recently with workers from the Open Hospitals Initiative, which is sponsored primarily by the Vatican and the AVS Foundation. In his message, the Holy Father said the Catholic Church should always be a place with open doors and one that welcomes interreligious coexistence. Syria is in the midst of a war that has lasted more than a decade. We go now to John Paulo Silvestri, Secretary General of the AVSI Foundation. Mr. Secretary General, thank you so much for joining us today. Can you tell us a little bit more about this audience with the Holy Father? What part of his message was most meaningful to you?
Yes. In this audience, the Holy Father, this audience was linked to the event about the project Open Hospital in Syria. In his speech, the Holy Father gave us some message. The first is not to forget Syrian crisis, because now Syrian crisis is not in the homepage of the media, newspaper, but the situation is very bad. The population below the poverty line is 90% of the total population. Half of the health system is completely destroyed, and are necessary resources, funds, and projects to help the Syrian population, the IDPs, and the refugees in the countries like Lebanon and Jordan.
And before the audience with Pope Francis, I understand that there was a press conference with Cardinal Zanari, Apostolic Nuncio to Syria. Can you tell us about this project, Open Hospitals, and the work and how the Vatican is helping?
Yes, this project, Open Hospital, was promoted by the Cardinal Mario Zanari in 2017, considering the health system in Syria that half of this system was destroyed. And the idea is to use these 3 Catholic hospitals, 2 in Damascus, 1 in Aleppo, and to open this hospital to all the population and to provide care treatments free of charge for the whole population. Through this project, Avsi, in cooperation with the 3 hospitals, provide until now 80,000 treatments to poor population in Syria. The plan is to continue until 2024 and to reach 140,000 patients in Syria with care treatments for different kind of needs. This is the core of the project. The project was supported by many Bishop Conference, U.S. Bishop Conference, Italian Bishop Conference, and many private Catholic foundations, and also some bilateral cooperations like Italian government and Hungarian governments.
We're almost out of time, but before I let you go, I know your foundation carries out humanitarian aid projects in more than 30 countries. What other initiatives are you working on at this time?
Yes, we work in 39 countries, but there are some countries, some crises in which we are very involved. The main are Haiti. Haiti is a very difficult situation. We can consider Haiti as a failed state. The institution, the public institution, has completely destroyed. There are some parts of the country that are controlled by criminal groups, and there is not a possibility to work, to travel around the country, the cities. And the population, we can say that 90% of the population is below under the poverty line. This is one of the main countries and main crises in which we work, and the other is the Ukrainian crisis. We work inside Ukraine with many projects, especially of food distribution in some area like Sumy, Poltava, Kharkiv, to provide food and protection services for the children in this area.
Mr. Secretary General, thank you so much for taking the time to speak with us today. We appreciate it. God bless you.